I am here today with Mr. Thomas Farrington, who is the president and founder of Prostate Health Education Network. How are you doing today?
I'm doing fine, Karen. Thank you. It's good to be with you this morning.
Well, I'm excited to have you here. We're going to talk about some really important things today, specifically the North Carolina Prostate Cancer Community Rally 2026. First of all, I want to thank you for joining us today to talk about this really important subject. And for listeners who are not familiar, can you tell us a little bit about the Prostate Health Education Network? What is the mission of this organization?
Yes, the Prostate Health Education Network is an organization I founded in 2003. I am a 26-year prostate cancer survivor. Back in 2003, after having been treated for prostate cancer and written a book called Battling the Killer Within, I decided to found this organization. The mission is to raise education and awareness about prostate health, prostate cancer among African American communities. Black men have the highest incident and death rates of all men for prostate cancer. And, I realize that a lot of work needs to be done in this area to raise awareness. And through that, we can help save lives.
So we hear a lot about healthcare disparities. Can you talk to us a little bit about what the numbers look like when it comes to prostate cancer and Black men? You mentioned just a minute ago that it affects Black men more than it affects other people.
Absolutely. When you mention disparities, prostate cancer has the largest disparity for all of the cancers. Black men are diagnosed at a rate nearly 80% higher than white men and all other men. We die at a rate more than twice that of all other men. So this is the leading disparity when it comes to any type of cancer as it relates to both incidence and mortality.
Wow, those numbers are terrifying. They're terrifying.
They're terrifying. And really, you see it when you begin to talk about prostate cancer, men begin to open up, you see those disparities in real life.
So you're not just an advocate, as you mentioned, you are also a prostate cancer survivor. Tell us a little bit about your journey.
Yes, I was diagnosed with prostate cancer in March of 2000. And that was 3 months after my father died on Christmas Eve of 1999 with prostate cancer. And in earlier years, I had lost both my grandfathers to this disease. But we never talked about prostate cancer. We never had the discussion. So when I was diagnosed, I really didn't know a thing about prostate cancer. I had to begin the process of learning. And so through that process, I began a journey that took me away from, I'm in Boston, Massachusetts, and I actually went to Atlanta, Georgia for treatment. Left on July 4th, 2000. And from there, I met a number of other men who were in treatment from around the world. We came there for the specialized treatment. And as I got to know these men, Karen, and their stories, what I told them was that our stories can help other men. So I actually gathered them and interviewed a number of them and to get their stories, to write it down. And a year later, I released a book, Battling the Killer Within, that talked about these men and our stories.
And I guess this whole journey was what led you, after writing the book, to launch the Prostate Health Education Network.
Absolutely. What happened then is the book kind of got a little bit more notoriety than I had anticipated. So people asked me to come and speak on the subject. So after speaking and a few times, I said, well, I should really just create an organization. And so that's how FIN was born. And today we are the leading prostate cancer patient education organization focused on the need of Black men. We're one of the leading patient education organizations for prostate cancer in the country.
That's pretty incredible. So
Thank you.
that's amazing to have all of that family history and then go through your own struggle. And then this came out of it. And now it's like you, your dad, and both of your grandfathers
Yes.
are helping all of these men.
Yep. Yep.
I
Our
love that.
stories and the stories of many other men, because we bring people in as we roll around the country with our mission
Mm.
and so we really recruit a lot of other people.
So, what message do you have for men that are afraid to get screened for prostate cancer or even talk to their physician?
Well, and that's one of the biggest issues, Karen. Men are reluctant, number one, to go to doctors. I know I was. In fact, it was my wife who forced me to go to the doctor to get a physical, where it was determined that I had prostate cancer. So I
Mhm.
understand that. We feel good. As long as we feel good, we are good
That's
in our
right.
mind.
We good.
We're good. So one of the key things that we focus on is really early detection and trying to
Mm.
get the word out that early detection saves lives. And that's what we are doing now with this campaign in North Carolina, this HBCU campaign. Is really through radio and
Mhm.
social media awareness campaign to let men know, number one, that with early detection, uh, you can beat prostate cancer. You have a
Yeah.
chance to cure it, and you have a chance to manage it successfully, like I have throughout your life. But if you
Mhm.
catch it late, chances are you will not be able to manage prostate cancer. So
Mm.
we wanted to get the word out that there's a real benefit to early detection screening. The second thing we try to do is get the word out. Men don't like to get the rectal exam. Men shy from that. They don't want to get it. I
Mhm.
understand. I've had many, and I never liked a single one of them. But with the early detection screening, we let men know that the recommendation today is to start with the PSA blood test.
Yes.
So what we're doing in Raleigh and with our other campaigns is we start with a PSA blood test. If that blood test shows that you are at a higher risk for prostate cancer, then we refer you for other examinations. But you
Mhm.
don't start with a DRE. You start with a simple blood test. And we try to, number one, raise awareness of the importance that you can beat it. And number two, you start with a simple blood test.
And what would you say to, wives, daughters, partners about encouraging the men in their lives to go get checked?
Well, as I indicated, it was my wife who forced me to go to the doctor to get an examination.
I love that you said forced.
Yeah, absolutely, she did. and so I would say that to all the women, you play an important role.
Mhm.
Uh, we we need your support, and by your understanding something about prostate cancer and the importance of early detection screening, to let the men that you love in your
Yeah.
life know that this is important, you can play a major role, a major role. So we ask you to get involved in this effort to save lives through early detection.
And an example of that, my sister stayed on top of her husband because he had his dad had passed from prostate cancer, and
Mhm.
she knew that this is something we need to be aware of. And his numbers kept going up and up and up, and he ultimately had a surgery over the holidays
Mm.
that is potentially life saving.
Yep,
So,
yep,
women, we can do a lot to
yep.
get these men to encourage them to go to the doctor. And if you got to bop them over the head, put them in the car and take them yourself, do what you got to do.
Do what you got to do, but you can save their lives.
Yes, yes. And that's what this is all about. So you've got an event coming up at Shaw on Saturday, April 25th. Tell me a little bit about that event.
Well, we decided we have worked over the years a lot with churches, and they've been
Mhm.
our key partners within communities to do outreach. And so this year we decided to let's broaden that. Can we let's look at other institutions that we can get involved with our efforts. So we decided to go with historical Black colleges know that they have a really good outreach in their communities. You know,
Mm-hmm.
people in Raleigh, and I'm an Aggie. I went to North Carolina A&T. So in Greensboro and in Raleigh, those institutions play a lead role at high level of visibility. So we decided that we would reach out to the leaders of these institutions and ask them to get involved with us to raise awareness and actually host efforts on their campus, screening and educational efforts. And so we're starting with 4 universities, 4 HBCUs. The first one was NCCU in Durham,
Mm-hmm.
Johnson C. Smith in Charlotte, North Carolina A&T in Greensboro, and Shaw in Raleigh. So we've done the first 3, and so we will end this first phase of our campaign with Shaw this weekend, and we will then analyze what we've learned and figure out how do we use that information to really perfect working with HBCUs around the country. So this is the first phase of our HBCU Strong Prostate Cancer Community Rally.
And the details for that event at Shaw, it's Saturday, April 25th from 9 a.m. to 3 p.m. And it's taking place at Tupper Hall, which is located at 118 East South Street in Raleigh. And men aged 40 and older are encouraged to come out and learn about early detection and receive a free PSA screening, correct?
That's right. And we have an education program. So those, you know, we have a very strong online education program for patients and survivors. We do a monthly managing survivorship webinar and roundtable discussions about different topics. And so with this campaign, we're bringing that as part of the early detection campaign as well. So we have an educational piece while men are being screened as well. And we include a free lunch.
Oh, and a free lunch.
And a
Okay.
free.
And registration is free and open to the public online. Where can people register?
At rapcancer.org. That's rapcancer.org. That stands for Rally Against Prostate Cancer. And if you don't register, you can walk in. We can register you at the door.
All right, fabulous. So any women that are listening, you better get that man to come to this event Saturday, April 25th at Shaw at Tupper Hall. So what's one thing you want every man listening today to remember about prostate cancer?
Well, remember that prostate cancer is a leading cause of cancer among Black men. It's the second leading cause of cancer deaths. But you can beat prostate cancer with early detection and knowledge. And that's what we're providing at these events. So get involved. There's no reason that you should die from prostate cancer if you catch it early. There are enough new treatments out there today. That's the reason I'm alive after 26 years, because there are new treatments that are being developed. But if you don't catch it early, these new treatments may not come into play. So take this opportunity to begin your efforts to beat prostate cancer. And you beat prostate cancer while you're healthy. You start while you're healthy. You know your PSA number, you follow that. And if you need to get some medical support, you can do it. You can do it early.
All right. Thank you so much, Mr. Farrington, for everything you've done. Your journey has definitely inspired a movement. And I'm so thankful and grateful that you've taken what you went through and what you saw your dad and grandfathers go through, and you're out here doing the work to save other Black men. And we appreciate that.
Thank you, Karen, and thank you for having me.